Do you have nagging knee pain? What if your knee isn't actually the problem? This week I will share my favorite Japanese healer Rendo Sugimoto's method to alleviate knee pain. Hello beautiful souls, I am Yasuko from Arigato Wellness and it's time for Massage Monday. When we have a knee pain, we tend to focus on the painful area, which is knee. But what if the problem isn't actually your knee? Unless of course you had a knee injury. This week I will share fascinating techniques that my favorite Japanese healer, Rendo Sugimoto, does to release the adhesions on other areas that are causing unnecessary stress on your knee. Disclaimer, please remember that this video is for educational purposes only and is not a substitute for medical advice. Do not do this if you have blood clots. Please see your healthcare providers for your medical issues. What may be causing the knee pain? Your knee doesn't move by itself. Every time you move, your brain sends signals to a chain of muscles and fascia throughout your leg. According to this fascia approach by Rendo, knee pain often occurs when other areas that should be moving together get stuck or adhered, causing the knee to compensate and bear too much workload. Interestingly, the areas that are actually restricted don't hurt at all. By gently reducing those stuck tissues, you can reduce the excessive stress placed on your knee. Do these techniques on the painful side, so if your right knee hurts, do this on the right leg. Take your time, no rushing. Step 1. Release below the big toe. Find the metatarsal below the big toe. It's this bone. Normally, the tissue should glide over this bone, but if you have knee pain, it may feel stuck here. Wrap your foot with 4 fingers of both hands. Using your thumbnails of the hook thumbs, gently scrape alongside the bone as if you're peeling the fascia away from it. Do this until it's loosened. Step 2. Loosen Achilles tendon. Next, find where your Achilles tendon attaches to your heel. Slide your finger up from the heel bone and feel a small dip where the tendon meets the heel bone. With your thumbnail, peel around this attachment on the inside for about 10 seconds. Use small movements to loosen the tissue. Then repeat it on the outside for about 10 seconds. Wrap the shin with 4 fingers of both hands and loosen the Achilles tendon by pressing down with hook thumbs. Do this from the heel to just below the calf. Then, press up the Achilles tendon from underneath. Do this from the heel to just below the calf. If you do this 2 or 3 times, you should feel it's loosened. This is beneficial especially if you feel the pain when you land on the foot as you go down the stairs, or the first step after you get up from the sitting position. Step 3. Loosen the middle of the calf. Now move to the center of your calf. Instead of rubbing across the muscle, use your hook thumbs to separate the muscle. Imagine you're gently pulling apart a strip of beef jerky. Do this until the tight spots are loosened. This is beneficial especially if you feel knee pain when you walk. If you find other parts of the calf tight, loosen them with hook thumbs. Step 4. Loosen along the shin bone. Now find the edge of your shin bone. Wrap the leg with 4 fingers of both hands. Starting just below the knee, using your thumbnails of the hook thumbs, slowly peel the tissue away from the shin bone on the inside. Repeat it on the outside of the shin bone. This may be harder to do. If these muscles are very tight, Go all the way to the ankle bone. Do this twice on each side, and you should feel they are loosened. Step 5. Loosen along the thigh bone. Finally, we will peel the fascia above the kneecap. Wrap the thigh with 4 fingers of both hands to anchor. From just above the kneecap to about halfway up your thigh, peel the muscles from the thigh bone downward on the inside. When you're peeling the muscles, think of separating soft tissues from the bone rather than rubbing the muscles. Then repeat it on the outside of the thigh bone. This is beneficial especially if you feel the pain when you stand up. When you move up and down as you peel along the bone, do it every 1 centimeter or half an inch, because Rendo says we inherently skip the tight spots. But if you do it in such small segments, you will hit the tight spots. Now feel your leg that you worked on and the other leg. Grab your ankles and tap your feet against each other. And see if they're balanced. Thanks for watching. Please like, subscribe, and click on the bell. Make it a great week.